as we can see few carious lesions on the teeth. So today she is with us. She is having a complaint of pain and sensitivity, and as we have done the IOPs and the X-rays of those particular tooth, so we found out that she is having cavities. Those are nerve approaching. But today I am not talking about the case only. Today I am talking about the approach. So today we have saved one of the tooth again, which is approaching to the root canal, and we have done the restoration in that. In restoration also, we always think that fissures, cusps, anatomies are just like that. So we always just dig the tooth and we place the composite or any other filling over there and do the restoration. So restoration doesn't mean, restoration means that we always do aesthetic as well as functional restoration of the tooth. So we have done the functional and aesthetic restoration of the tooth, and we are quite satisfied, and I guess we have saved another tooth of going for root canal treatment, and I guess that is more satisfactory than approaching for the final treatment. So I always request to my fellow dentists as well, to my patients also, that they should think and they should ask their dentist before going for any kind of treatment. So the explained consultation is always required. So I always request to my fellow dentists as well as to my patients just to think before doing what they are doing.